Imagine 6,000 intrusive thoughts a day. Not normal, everyday stuff like where to go for lunch, but dark thoughts, which make you feel like the worst person in the world.
And all the murderers came out, and obviously it was like an ice skating rink, so skimming across trying to kill Banquo.
Imagine your worst fears served on a plate, over and over again. It takes the things you love, rips them apart, and makes you the guilty party. For me, that's OCD. Cheers. It's like a dark guilt descending on you every time you remember. False memories of evil events that weren't even real. Feeling so ashamed and alone with my thoughts. I see my friends, but I can't even tell them. OCD grinds you down to your lowest point. Like anxiety on steroids, it pushes you to the very edge. It's an urgent reality I can't ignore and can't confront. So I think things I never thought possible. This therapist is going to say I'm a bad person, a threat to society, that I need to be locked up. Wait, they want to help me. My thoughts are false. They are not me, and I am not my OCD.
Naomi, can you tell me what's happening to the main character in our film?
Well, Sean, the main character appears to be struggling with recurrent, persistent, distressing, intrusive thoughts that she's trying to resist, that we would term obsessions.
So what are obsessions?
Well, obsessions are a cardinal symptom of obsessive compulsive disorder, and they're recurrent, persistent thoughts or images or impulses that are experienced as intrusive and unwanted, and that are associated with considerable distress and anxiety. And in response to the thoughts, the individual tries their hardest to suppress them or to replace them by substituting another thought or behaviour to neutralise them. And we call these thoughts and behaviours compulsions.
So what are compulsions?
Well, compulsions are recurrent thoughts or behaviours that are performed either in response to obsessions with the intention of neutralising them, or performed according to rigid, stereotyped patterns. Now, these behaviours are intended to either prevent the dreaded consequence of the obsession or to reduce anxiety and distress. But in actuality, they're not realistically connected with their goal, or they're actually exaggerated or excessive, and they become very time-consuming and preoccupying.
So the obsessions raise anxiety and the compulsions are meant to bring it down, but actually they don't.
That's exactly what happens. So the individual tries to reduce the anxiety associated with the obsessions by performing the compulsions. But in real life, that doesn't happen. And so each perpetuates the other in a vicious cycle. Now, obsessional thoughts and compulsive behaviours are really quite common, but it's when they become very time-consuming, when they become all-consuming, that this becomes obsessive compulsive disorder, which is a very disabling mental disorder.
Because many people would have rituals and ways of doing things. I mean, I tend to sort of go back to check I've locked the door or that I've turned the oven off or something like that, but that's not OCD until I do that 100 times and can't go out and do my work in the day. Is that what we're saying?
That's exactly what we're saying. There's a spectrum of severity, and once it passes the threshold of really significantly distressing you or causing some kind of functional problem, it becomes a disorder.
What are the commonest types of OCD?
Well, the symptoms that our character showed are very common. These are fears, what if, there's usually a what if character to the obsessions, the fears of acting aggressively or doing something harmful, but also very common are fears of catching or spreading contamination with germs. And of course, under the recent COVID pandemic, this has become very prevalent. There are also fears of getting things wrong or things not being in the right place or in the right order. And so the associated compulsions are checking, washing, cleaning, ordering and arranging, and sometimes counting to double check that things are okay.
And when does OCD start to show itself in people? Is it a childhood thing, or could it happen in later life?
We're more and more realising how early OCD comes on. It usually comes on either in childhood or adolescence, and it's very unusual to develop it de novo from the start over the age of 30. So it's an early onset disorder, and it tends to come on insidiously and gradually, and before you know it, the problem has developed.
So our main character in the film is mid-20s, late 20s. She may have been struggling with that for all her life, and we're only seeing that snapshot of her in her 20s, but this is something that people struggle with for a long period of time.
In fact, for reasons that are becoming apparent, people with OCD seem to present really quite late for treatment, which is very disappointing because we know that treatment works better if you can start treatment sooner. And research seems to suggest that people with OCD struggle for at least 7 years before they come to clinical attention, which is a very long time.
That's tragic, isn't it? So people are struggling on average for 7 years, some for longer.
Some for longer, yes.
Struggling with sort of situations that we've seen in the film.
Yes, and of course the more they employ their compulsive strategies, the more embedded these strategies become and the harder it is to stop doing it.
I remember when my son was diagnosed with OCD at the age of 13, someone said to us, oh, it's actually really good, you've got it early, that's really good. And I remember thinking, our family is really struggling. That seemed like quite an insensitive thing to say, but actually over time I've realised that it's a good thing that we got it early, because it sort of gave him the tool book, or the tools just to sort of be able to work through his OCD at a young age where he was learning lots of things in life. Whereas if he was learning that at 40, maybe those things wouldn't have stuck.
Yes, that's exactly the problem.
Is there a cause of OCD?
We're not entirely sure of the root causes of OCD, but we seem to believe that there's a roughly equal contribution of genetic factors. So genes, the DNA, are the building blocks of the cells in the body and determine how the body functions and the brain functions, and an equal share of environmental factors. So those may be the life events that you experience. We've all gone through a pandemic, for example, and that's generated a lot of new OCD amongst at-risk people, but also internal environment. So inflammation or infection may also trigger OCD. And these environmental and genetic influences or root causes converge in affecting brain function that leads to processing problems that render people vulnerable to OCD.
So what are the types of situations that make people vulnerable? You know, all those things you say.
Well, the sorts of processing problems that we've found in our research include difficulties thinking flexibly. So people with OCD can't disconnect easily from anxious thoughts and can't turn their attention to something else, and that talks to the fact that people get caught up in these repetitive cycles of very narrow repertoire of thinking and behaving. They also have difficulty stopping a behaviour once it's started, and that talks to the fact that once someone starts their compulsions, they feel a need to complete them to the end. They also seem to react more strongly to errors and mistakes, and to things not going to plan. I think that talks to the fact that people with OCD like to control the environment, because anything going wrong is experienced as aversive, which you try and avoid. And another important processing problem is a predilection for habit, for doing things in a habitual way. And so patients very often tell me that they started doing their compulsive rituals because of obsessional thoughts. So they would clean in a certain way. But after a while, it became a habit. So they just clean that way because that's the way they clean. And so altogether, this renders an individual more vulnerable to developing OCD.
In the film, we saw how our main character was struggling, and we could see how people from the outside were reacting on what they could see, and they actually couldn't see much, they wouldn't notice much. So the man on the date, he just sort of looked at her as if to say, are you okay? Maybe she'd sort of zoned out, and the lady on the bus stop wouldn't have a clue. Is that the case often, that you actually wouldn't have a clue that someone next to you might be really struggling with OCD, but it wouldn't show on the outside?
That's absolutely the case, and I think that's probably a reason why OCD is underestimated. Its impact is underestimated amongst the public and amongst clinicians as well, because when people are very disabled by this disorder come to see you in your clinic, they look absolutely normal, and there's no way of knowing what's going on in their head.
I wonder if another thing that plays into that is that some of the thoughts are taboo. So in our film, these are violent thoughts, but they could be sexual thoughts. And they're the last things you want to talk about, aren't they? So people actually don't want to talk about these things, these thoughts that they're having.
Quite right. There's understandable shame and fear around the thoughts. People imagine living with these thoughts day in, day out. After a while, it's very hard not to believe that there may be some substance to them. This is what people are struggling with. So they're scared of divulging them, so they may do everything they can to avoid letting on what's going on in their head. Also, after a while, may have lost insight and believe that they really are dangerous, and so they fear divulging the thoughts because they fear the consequences of doing so. And given that these behaviours and problems often start young, parents are often also reluctant to divulge these problems to professionals in case their child is stigmatised or some adverse consequence. So for all these reasons, OCD tends to remain a secretive disorder for many years. But of course, by the same token, it's important to have services and clinicians ready and available to be receptive to the problem. And sometimes that's not the case. And again, during the pandemic, it's been very hard to see doctors and clinicians, and that hasn't been helpful for people with OCD.
And if you think of OCD as a sort of monster sitting on your shoulder, that's exactly what the OCD wants. It wants you to internalise it and not talk about it.
That's right. The longer it continues, the more power it has over you.
OCD can be trivialised by many people, and if you ask lots of people about it, they might just say, oh, it's the stereotype of cleaning, but it is many more things than that, isn't it?
That's absolutely the case. I don't want to underestimate the importance of publicising OCD and people talking about it. I think talking about it is important, but we do need to understand that it can be a very serious and dangerous disorder for a lot of people. It's not just a bit of excessive cleaning. It's a very distressing and functionally disabling condition. It needs to be treated seriously.
And when you say disabling, it can be just as debilitating as a serious physical disability.
Absolutely. We have people who are incarcerated in their homes, who can't perform normal activities of daily living, can't wash, can't cook, can't go to the toilets. Their whole life has been put on hold because of OCD, sometimes for several years. It's a very serious condition in its severe forms.
So Naomi, these obsessive thoughts are the sufferer's worst fears.
Yes, you're right, Sean, they are, and they're coloured, of course, by societal influences. So when I started treating OCD back in the 80s, people were obsessed with the fear of catching AIDS because that was in at the time. Nowadays, people are scared, I think mostly of committing some kind of aggressive act or a inappropriate sexual act, paedophilia. And it's this fear of committing this taboo act that preoccupies people and scares them.
So it's like the OCD latches on to the big topic that people are talking about and turns that into a fear.
That's right, yes.
Are those people who are struggling with OCD likely to act on their thoughts?
Well, no, that's the important message we need to get across, that the obsessional thoughts not only involve the fears of doing something, but the struggle against doing it, and that people with OCD are most unlikely to do anything dangerous, and certainly not to commit the acts they're worried about.
So if someone's watching this now and they are familiar with some of the things you've said and they think, I've had some of those thoughts, what would you say to them?
I think, first of all, take them seriously. And if they are time-consuming and distressing and troubling you, then I think you should go and speak to someone who knows something about OCD, and the first port of call would be your general practitioner.
And that can be really hard for someone to admit to some really dark thoughts.
Yes. I mean, it can be helpful to go online and look at some of the OCD consumer support groups like OCD Action that can help you clarify your thinking. But ultimately, it's important to communicate with a health professional.
One of the scenes in the film had our main character on a bridge and she was thinking about jumping. Is there a higher rate of suicide attempts amongst people who have OCD?
Yes, suicidal thinking is very common in OCD, and you can imagine, as we've talked about, this is an illness that's gone on usually a long time, and it wears people down. And suicide attempts are also really quite common. In fact, based on the statistics that we know, approximately 1 in 10 people with OCD at some point in their life will attempt to kill themselves. Now, that's a very worrying and alarming statistic.
I mean that is quite shocking, and for someone who maybe is caring for someone with OCD, that's worrying, and obviously for the person who is struggling with OCD, that's worrying. If someone is watching this and they think all the things you've said here sound like they may be thinking they have OCD, what are the first steps then, and then what are the next steps to maybe seeking treatment, and what is the likely treatment?
So I think the first thing to say is that there are treatments available, and so it's important to engage in health services, meet with health professionals to talk through what treatments are available in your area. The two most common forms of effective treatment are a psychological form of treatment called cognitive behaviour therapy that involves exposing yourself to these obsessional thoughts. Now remember, the person with OCD is doing their utmost to avoid thinking these thoughts. The treatment actually involves helping the person hold a thought and learn that they're irrational and that nothing bad is going to happen, by helping them stop doing their compulsive behaviours, and that way break the link between the obsession and the compulsion. And in so doing, the power of the thoughts diminishes and the patient can let go of them.
So you're literally asking someone with OCD to face their fears?
Well, it's performed in a very gradual way, but it's very labour-intensive and potentially anxiety-provoking treatments. So it doesn't work for everyone, but if you can manage the treatment, it can be very successful. The other key form of treatment is with medication, and the drugs now are available are selective serotonin reuptake inhibitors that your GP can very easily prescribe for you. And using either of these two treatments, which should be available throughout the UK, most patients with OCD will make a considerable improvement in their symptoms.
And what if treatment doesn't work?
Well, not everyone responds as well as they might to these two treatments, so we do have other treatments available. They may require more specialist care. There are other forms of medication available, and some of these are being researched at the moment with support from Orchard, so different kinds of medication acting on other brain systems. As we're elucidating the brain circuitry involved in OCD, there are forms of brain stimulation that are being developed for OCD. And there are more holistic forms of treatments, for example, exercise or keeping occupationally active that can be very helpful for OCD as well. So there's a lot of new treatment in the pipeline. It's quite an exciting time to be a researcher in OCD, and I'm hoping those fruits will be available for patients very soon.
Can you give us a bit more detail about some of the treatments that Orchard are actually researching?
Well, Orchard have supported a number of controlled trials, a couple of them in different kinds of medication in OCD. One's in a new form of medication called tolcapone, which is actually being repurposed from Parkinson's disease. It acts on a chemical called dopamine in the brain. There's some evidence that that might be helpful, so we're very interested to see how that research turns out. There's some other interesting work looking at psilocybin, which, like the SSRIs, acts on serotonin, but in a different way, to see if that improves the flexibility that I mentioned is impaired in OCD and helps people with OCD. So we're very excited about that. And then Orchard is also supporting work looking at brain stimulation in OCD using direct current stimulation, which is a small 2 milliamp current that people can apply themselves in their home that could be scaled up and used by people for treating OCD in a more convenient way.
And you mentioned exercise.
Well, we talked about inflammation being a potential cause of OCD, and exercise has potent anti-inflammatory effects. So there's preliminary work suggesting that high-intensity exercise can be helpful in OCD. So that's something else we're researching at the moment.
It feels like you're trying to work on building an armoury for a medic. So when someone presents with OCD, the medic doesn't just have one or two ways of treating OCD. They actually, something could work for one person and then they could choose something completely different for another person.
That's absolutely right. There are likely to be many approaches, and the key for the future is going to be able to single out those individuals who respond best to one of these approaches, and we can have a more precise way of treating the disorder rather than the blunderbuss approach that we use at the moment. And so a lot of research is focused on identifying these markers that will help clinicians and patients understand which treatment will suit them best.
And that's going to give a lot of people a lot of hope. Are there certain types of groups in society that are underdiagnosed with OCD?
Well, we know that people with from ethnic minority groups tend to present either late or not at all with OCD. And so certainly a job of work to be done to be encouraging minority groups to come forward for treatment.
And that sort of ties in with the stigma. There's a stigma around OCD, and if certain cultures or communities struggle with those stigmas, it's going to be harder for people to come forward.
Certainly, and if you're from a culture or ethnicity that has been stigmatised by services, then of course you're also less likely to come forward as well.
And what about amongst men and women? Does it present equally amongst them?
OCD roughly affects men and women equally. Males tend to get the disorder a little earlier, females a little later. Females tend to come forward for treatment more. So it's really important, if there are any males out there watching, for them to be familiar with the problem and seek help if they need it.
And when you say females later, what do you mean, as in 5 years later or 20 years later?
Around about 5 or 6 years later. Pregnancy and having a baby often triggers OCD, and many women come forward for treatment after having a baby.
There are many people who have really had their lives seriously affected by OCD. But what you're saying today gives some hope, doesn't it? There is hope for the future, that even if you're treatment resistant for the current treatments, there are things in the pipeline that can help in the future.
I think there's a lot of hope for people with OCD. They should feel confident that if they come forward for treatment, there'll be something for them to help them.
So there is hope out there. Naomi, thank you very much for talking to me.
My pleasure.